Hello everyone, welcome again to Code Web Training. Today we continue our training series on ICD-11, an important milestone in how we classify and report health and disease worldwide. The topic today is the structure and taxonomy of the ICD classification. ICD-11 represents a modern, evidence-based framework designed to capture more nuanced clinical concepts, support better patient care, improve public health surveillance, and enable richer data for research and policy decisions. It reflects advances in medicine, digital health, and international collaboration, while remaining rooted in the familiar structure of ICD-10 that you have relied on for years. Over the course of this session and the series to come, we will dive deeper into other features, resources, and tools of ICD-11. Code Web Training is a foundational introductory resource to help you become familiar with ICD-11 concepts and terminology. It is not a substitute for a comprehensive, formal ICD-11 training program. For full proficiency and certification, please pursue an in-depth in-person or formally structured course delivered by recognized ICD-11 providers. Today with this session, we announce the 2026 release of ICD-11 with refined clinical content, expanded extension codes, updated mortality rule base, and new data quality validation framework known as CodeEdit. Now there are more than 6.3 million searchable code combinations, and ICD-11 2026 supports 21 languages. While we introduce ICD-11, ICD-10 remains in active use for many programs during the transition. To support you fully, our CWT program will continue to cover ICD-10 topics in upcoming sessions, ensuring you stay proficient across both coding systems. Thank you for joining this important journey. Together we will unlock the power of ICD-11 to improve mortality reporting, support better patient outcomes, and strengthen health data worldwide. Let's begin with a high-level tour of what's new, what stays familiar, and how this transition will unfold in your daily coding practice. Here is my lesson plan. I will start with taxonomy and structure. Then we will discuss about chapter structure, ICD-11 foundation, multiple parenting, and ICD-11 code types and concepts. Let's begin with taxonomy and structure. ICD's chapter and block structure have evolved over 150 years in 11 iterations of classification, because now we use ICD-11. The evolution of ICD carefully balances the need for categories that match current knowledge and statistical comparability over space and time. A statistical classification allows for different levels of detail if it has a hierarchical structure and subdivisions. A statistical classification of diseases could retain the ability to identify specific disease entities and to allow the statistical presentation of data for broader groups. The ICD is a variable axis classification. Structure has been developed as proposed by William Farr, a great epidemiologist. Epidemic diseases, constitutional or general diseases, local diseases arranged by site, developmental diseases, injuries. These groups remain in the chapters of ICD-11. ICD is rather practical than a theoretical classification. The classification is based on etiology, anatomical site, circumstances of onset or other criteria. ICD-11 can combine several codes to describe a clinical condition to the desired level of detail. Let's go through ICD-11 chapters. Chapter 1 is for infectious or parasitic diseases. Chapter 2, neoplasms. Chapter 3 is for diseases of the blood or blood-forming organs. Chapter 4 is a new chapter for diseases of the immune system. Chapter 5, endocrine, nutritional or metabolic diseases. Chapter 6, mental, behavioral or neurodevelopmental disorders. Chapter 7 is a new chapter for sleep-wake disorders. Then we have the diseases of the nervous system as Chapter 8, Chapter 9, diseases of the visual system, Chapter 10, diseases of the ear or mastoid process. Chapter 11 is for circulatory system diseases, Chapter 12, respiratory system diseases, Chapter 13, the digestive system diseases, Chapter 14 covers skin diseases, and Chapter 15 is for the diseases of the musculoskeletal system or connective tissue. Chapter 16 covers the diseases of the genitourinary system. Chapter 17 is a new addition which covers conditions related to sexual health. Chapter 18, pregnancy, childbirth or the puerperium. Chapter 19, certain conditions originating in the perinatal period, and Chapter 20 covers developmental anomalies. Chapter 21, symptoms and signs. Chapter 22 is the chapter for injury, poisoning or certain other consequences of external causes. Chapter 23, external causes of morbidity or mortality. Chapter 24, factors influencing health status or contact with health services. Chapter 25, codes for special purposes. There is new Chapter 26. This is the supplementary chapter for traditional medicine conditions. And then there is another section, supplementary section for functioning assessment, V section, and then there are extension code section, extension code starting with X. This is again a new addition. ICD-11 has 26 chapters. ICD-10 has 22 chapters. As you know, ICD-11 comprises of 26 chapters. The chapter numbering is in Arabic numbers and not in Roman numerals as in ICD-10. Chapters 1 to 9, the first character of the codes is the chapter number 1 to 9. Chapters 10 to 26, the first character of the codes is an English letter A to S except I and O. X is the first character in extension codes. As you all can see, there are 26 chapters in ICD-11. The first character for the first 9 chapters is the chapter number. The first character for the chapters 10 to 26 is an English letter A to S except I and O. The first character for extension codes is letter X. As I told you before, letters I and O have been removed from ICD-11 to avoid confusion of I with 1 and O with 0. Talking more about code characters, as I told you before, Letter X is the first character of extension codes. Then letter Y is reserved for other specified categories, but not in the first character position. Then letter Z is reserved for the residual category unspecified, again not in the first character position. Talking about new chapters, ICD-10 chapter 3, diseases of the blood and blood forming organs and certain disorders involving the immune mechanism, is split into two. We have chapter 3 in ICD-11 for diseases of blood or blood forming organs, and chapter 4 of ICD-11 for diseases of the immune system. ICD-10 chapter 5 mental and behavioral disorders is split into two. Chapter 6 mental, behavioral or neurodevelopmental disorders, and chapter 7 to cover sleep-wake disorders. ICD-10 chapter 14 diseases of the genitourinary system is divided into two. Chapter 16 diseases of the genitourinary system, and chapter 17 conditions related to sexual health. Let's talk about code structure. Just to remind you about ICD-10 code structure, ICD-10 codes are alphanumeric. This means the codes comprise of alpha characters, English letters and Arabic numbers. Range from A00 to Z99. Minimum 3 characters and maximum 5 characters, that is 2 levels of subcategories. Always there is a letter in the first character position. The letter U was not used originally, subsequently assigned for codes for special purposes. For example, COVID-19 code U07.1 and U07.2 and other U codes, and then the codes for SARS. Talking about ICD-11 code structure, codes are again alphanumeric, alpha characters and Arabic numbers. Range from 1A00.00 to ZZ9Z.ZZ. Minimum 4 characters and maximum 6 characters, that is 2 levels of subcategories. Always letter in the second position. Always a letter in the second position to distinguish ICD-11 codes from the codes of ICD-10. The letters O and I are omitted to prevent confusion with the numbers 0 and 1. ICD-11 uses alphanumeric codes for flexibility and easy expansion, as in ICD-10, and supports a greater number of codes and combinations. Talking about code structure, the first character of the code always relates to the chapter number 1 to S. For the first 9 chapters, the chapter number 1 to 9, a number, and for the chapters 10 to 26, an alpha character from A to S. There is a number at the third character position to prevent spelling undesirable words. For example, BA50 is for old myocardial infarction. There is a number between A and 0, and if this were an English letter or alpha character, it is possible that we will pronounce some undesirable words when there are 3 English letters together. So the code structure is like this. The first character is the chapter indicator. The second character is always an alpha character to differentiate from ICD-10 codes. And the third character is always a number to avoid undesirable word pronunciation or spelling. So there are categories with 4 characters and there are subcategories, so all together the maximum 6 characters. Let's discuss about ICD-11 foundation. The foundation component represents all ICD entities like diseases, disorders, etc. It's a huge network of entities, diseases, disorders, injuries, etc. Foundation represents the entire ICD-11 universe. The foundation is a multi-dimensional collection of tens of thousands of interconnected entities called classes or nodes. Every node of the foundation has a unique entity ID, URI, which is a unique web address for every entity. As you all can see in this screen, this is the unique entity ID or URI. Which is a unique web address for every entity. A node can have multiple child and parent nodes. So it is something like this. A huge network of categories, entities. And each entity has a URI, unique resource identifier. Therefore, every entity in the foundation has a URI, unique resource identifier. Only the most common or important terms are given ICD-11 codes. These form the ICD classification or linearization, categories with codes. The rest have only URI with no code. Appear as index terms under the categories to which they are classified and take their codes. So every entity in the ICD-11 foundation has a unique resource identifier. However, only the most common or important terms are given ICD-11 codes, and they form the ICD classification or linearization. However, those without codes have only URI, unique resource identifier, and they appear as index terms under the categories to which they are classified and take their codes. This means there are categories with codes, and these entities without ICD codes and those who have only URI are categorized under these index terms. Let's discuss this in detail. So just to explain this concept, in Google Maps, each location has a unique identity, the longitude and latitude. So this is a Google map of city of Kandy in Sri Lanka. So this is the Kandy hospital, and you know the longitude and latitude is this. Kandy is a beautiful city in Sri Lanka. Similarly, in the ICD foundation, there are specific locations for each disease entity. Specific locations for each disease entity. For example, GB 20.0, fibrocystic change of breast. This is an ICD-11 code. There are other categories: fibrosclerosis of breast, chronic cystic breast, chronic mastitis, chronic cystic mastitis, cystic dysplasia of breast, and cystic hypertrophy of breast. These categories or these entities have their own URI, unique resource identifier, but they all share the code GB 20.0, the code for fibrocystic change of breast. As you all can see, fibrosclerosis of breast is GB 20.0, ICD-11 code. Chronic cystic breast, the code is GB 20.0, and chronic cystic mastitis, cystic dysplasia of breast, and cystic hypertrophy of breast, all these conditions share the same code GB 20.0. However, GB 20.0 for all these conditions. However, they have different URI. This means there is specific unique URI for each and every entity while they are indexed under the common code ICD-11 code GB 20.0. Same ICD-11 code, different disease entities, but they have been enlisted under GB 20.0, fibrocystic change of breast. Similarly, vulval cellulitis. The code is GA00.0, the code for acute vulvitis. So in the foundation, acute vulvitis has a code GA00.0, but there are index terms under acute vulvitis. Acute vulvitis, allergic vulvitis, atrophic vulvitis, inflammation of labium, labial infection, radiodermatitis of the vulva, vulval cellulitis, and vulval infection. They all share the code GA00.0, the code for acute vulvitis. And these conditions are index terms. However, they all have unique resource identifiers. Here is the URI for acute vulvitis, but there is a specific URI for vulval cellulitis. Similarly, for all the other conditions, there are specific URI. Here is another example. DB 90.0 is the code for abscess of liver, and this is the URI. There are multiple other conditions in liver. Only amoebic liver abscess has its code 1A36.10, but all the other types of liver abscesses share the same ICD codes DB 90.0, but they have different URI. You can see periportal abscess, pilophlebitic hepatic abscess, capillarisis due to capillaria hepatica, bacterial liver abscess. They all share the common ICD-11 codes DB 90.0, but they have specific unique resource identifiers URI. The foundation is a huge database of health conditions and medical terms. Each disease entity has a unique identifier in the foundation, which is known as URI. Not all foundation entities have ICD-11 codes in the classification, but all of them have URI in the foundation. The URI remain attached to its entity, so it doesn't change when ICD-11 is updated or translated. With new updates, the URI will remain the same and it will not change. Unique resource identifier is a string of characters that uniquely identifies or points to a resource which is a specific ICD-11 entity. The entity's specific place in the WHO foundation is the URI. A URI attached to an entity is permanent. It will never change. What do you mean by ICD linearization? A linearization is a subset of the foundation component, fit for a particular purpose, reporting mortality, morbidity, or other uses. Jointly exhaustive of ICD universe foundation component, that is, the union of the categories equals the entire space of ICD concepts, composed of entities that are mutually exclusive of each other. Linearization is similar to the classical print versions of the ICD tabular list. For example, volume 1 of ICD-10 or other previous editions. Rare diseases. Data on rare diseases remain preserved when captured by ICD-11 coding tool. Many rare diseases do not have their own ICD-11 codes. However, every one of them has its own URI. For example, Sack-Barabas syndrome. The code is LD28.1Y, as you see in this diagram. But Sack-Barabas syndrome is a rare disease, has a unique URI, so it is saved within the foundation and it is captured by the ICD-11 coding tool, even though it is a rare disease. Let's talk about parent-child relationships. Hierarchical structure of ICD-11 groups similar entities together. Parents are at the top level in the hierarchy, while children and siblings provide more granularity. Entities are known as siblings when they are co-located under one parent. All entities under a parent are considered siblings. Here you can see the parent-child sibling relationships. Mycosis is the parent. Then you have child 1F27 cryptococcosis, and then there are siblings under child 1F27.0, 1F27.1, 1F27.2. They are siblings. So all entities under a parent can be considered siblings. So there are children and siblings. What do you mean by multiple parenting? Occurs when a foundational entity is correctly classifiable in more than one place within ICD-11. This means some entities have more than one parent. When an entity has one or more parents in the ICD-11, It is displayed in multiple locations with emphasis on its primary parent. Its secondary parent is displayed in grey. Here is an example. Neoplasm is the primary parent and malignant neoplasm of the breast is the child. So malignant neoplasms of the breast is classified, listed under the primary parent neoplasms. Here you can see the primary parent. However, malignant neoplasms of the breast is also listed under a secondary parent, diseases of the genitourinary system. Under the secondary parent, malignant neoplasms of breast is also listed, and diseases of the genitourinary system is the secondary parent. However, under the secondary parent, the entity is displayed in grey. And we talk about hierarchy. So ICD-11 has a hierarchical structure. So we have chapter 15, diseases of the musculoskeletal system or connective tissue, and then categories are again divided, so it has a hierarchical structure. FPA 10.2, fungal infection of joint, is in the lower level of hierarchy. But we have infection related arthropathies at a higher level and arthropathies at an even higher level, and then the highest level of hierarchy in this chapter is the chapter level. Another concept is block codes. Block codes are high-level entities in ICD-11 called blocks, may be used for reporting aggregated statistics. However, blocks do not have category codes as they are not supposed to be used in coding. Blocks have their own URIs. Blocks may also be referred to by block IDs. The code structure for block ID is 11 characters long. Okay, let's discuss about other ICD-11 code types and concepts. There are different code types and concepts. There are stem codes. There is a concept called pre-coordination. There is another concept called extension codes, post-coordination, and cluster coding. What do you mean by a stem code? Stem codes are the codes that can be used alone, and they found in the tabular list of ICD-11, and they are the entities of groupings of high relevance. Clinical condition that should always be described as one category. So they are represented by stem codes. And the design makes sure that in use cases that require only one code per case. Here is an example. Hutchinson-Gilford syndrome. The code is LD2B, which is a stem code because Hutchinson-Gilford syndrome is represented by a single code that can exist alone. What do you mean by pre-coordination? Stem codes may contain all pertinent information about a clinical concept in a pre-combined fashion. Already combined. The information is all pertinent information is already combined. This is referred to as pre-coordination. For example, BD 50.40 abdominal aortic aneurysm with perforation. All clinical information is pre-combined. CA 40.04 pneumonia due to Mycoplasma pneumoniae. All pertinent information is pre-combined. So these are pre-coordinated codes, and they are also stem codes. Another concept is extension codes. Extension codes is the standard way additional information is added to a stem code. Extension codes can never be used without a stem code. In other words, they cannot exist alone. They cannot be used alone. Can never appear in the first position in a cluster. Extension codes will never appear in the first position of a code cluster. We will talk about code clusters later. Extension codes start with the letter X. For example, the code for testicular seminoma right, we have the code 2C80.7, 2C80.7, which is the stem code, and then the extension code to indicate laterality or the right side is XK9K, which is an extension code. Indicates the laterality. We can indicate whether the condition is on the right side or on the left side. There are two types of extension codes. Type 1 extension codes adds detail on an entity or disease coded from ICD-11 chapters 1 to 26. Then there are type 2 extension codes, qualify a diagnosis and can be applied to codes from any chapter. Type 1 extension codes. The extension codes comprise of groups of codes. Anatomy, agent, histopathology, laterality, etc. are represented by type 1 extension codes. Type 2 extension codes will represent discharge diagnosis types, used in morbidity coding to indicate main condition, main resource condition, initial reason for encounter or admission, and also to indicate diagnosis timing, a condition that was present on admission, or to indicate a condition developed after admission, or condition uncertain timing of onset relative to admission. And diagnosis timing in relation to surgical procedure, diagnosis method of confirmation, diagnosis certainty, obstetrical diagnosis timing, encounter descriptions. They can all be represented by type 2 extension codes. Here is another example for an extension code, cancer right breast, in the coding tool. And you can see the code is 2C6Z. This is the code for malignant neoplasms of breast. And to indicate the laterality, we use the extension code XK9K. And as you all can see, the stem code is combined with the extension code using an ampersand. This is a standard symbol used to combine the extension code, stem code, with an extension code. So extension codes will never be used alone without a stem code. They cannot exist alone. Can never appear in the first position of a cluster. and always start with letter X. Okay, let's discuss the concept post-coordination. What do you mean by post-coordination? Post-coordination refers to linking multiple codes together to fully describe a documented clinical concept. So you may combine stem code with another stem code. Stem code with an extension code. Stem code with a stem code and an extension code. Stem code, extension code, and stem code, extension codes. There are multiple combinations. To separate stem code with another stem code, you will use the standard symbol /, and to combine stem code with an extension code, you will use the standard symbol ampersand. Stem code / stem code ampersand extension code. So this is called post coordination. You can keep on combining other codes as you fully describe a documented clinical concept. Now you can see here adenocarcinoma right bronchus. So we have the code for adenocarcinoma of the bronchus 2C25.0, and we post coordinate to add an extension code XK9K to indicate laterality, right side. So this is post coordination. We have post coordinated to add the laterality, and we use an extension code. Cluster coding is a convention used either / or ampersand to show more than one code used together. As I described before, to create a code cluster, you use these conventions / or ampersand. For example, stem code / stem code ampersand extension code. Let's see this example. Duodenal ulcer with acute hemorrhage. The code cluster is DA63.Z / ME24.90. The condition DA63.Z is for duodenal ulcer unspecified, which has a manifestation. Therefore, we use additional code to indicate acute hemorrhage or acute gastrointestinal bleeding. The code is ME24.90. Duodenal ulcer unspecified / acute gastrointestinal bleeding not elsewhere classified. In the coding tool, DA63.Z, duodenal ulcer unspecified, has a manifestation, so we add additional details by post coordination. We have the code ME25.90, acute gastrointestinal bleeding not elsewhere classified, and here is the cluster. Stem code and another stem code. Another stem code. Two stem codes are combined together. This is post coordination and creating a code cluster. Duodenal ulcer with acute hemorrhage. So ICD-11 facilitates cluster coding to explain a clinical concept in a desired level of detail. / is a separator between stem codes. Ampersand is a separator between stem codes with one or more extension codes. Vertical bar is used in mortality coding, is a separator between lines in part 1 of the medical certificate of cause of death. This is also a standard separator. An asterisk is a separator between part 1 and part 2 of medical certificate of course update. Let's go through this example. We have BD10 line 1A, 1B, BD5Z, and then in part 2 we have BA511 / 9B71.0Z. The cluster is BD10 vertical bar BA5Z asterisk to separate from part 1 the part 2 conditions 5A11 / 9B71.0Z. So vertical bar expresses the separator between lines in part 1. Asterisk expresses the separator between part 1 and part 2. / shows the cluster as a separator between stems following the convention of ICD. There are other general features of ICD-11. ICD-11 categories have short and long descriptions labeled additional information. A short description is a maximum of 100 words. The short description is information about a disease or condition and necessary to understand the scope of the rubric. The long additional information is the full description without length restriction. Special tabulation lists continue to exist in ICD-11. Special tabulation list for tabulation purposes. But there are 3 additional lists: the start of mortality list, the list for verbal autopsy, and the list for the list of infectious diseases by agent. Now we come to the end of today's video, and you will do the exercises, and exercises will be emailed or posted in the WhatsApp group. So after studying this video, after watching this video, you can do the exercises and the answers will be discussed in the live session. The next CWT, we will announce the date, but it will be on ICD-11 tooling environment. So we will discuss the tools one by one in the upcoming video or upcoming live Coder Web training session. So thank you very much for listening, and for more information please contact